interview with Dr. Joseph Kahn, who just gave a lecture here in the Bahamas at the 4th Global Conference of MIS implants. Dr. Kahn, so tell me a little bit about the issues that you touch in this conference here in the Caribbean.
Sure. Well, we talk about immediate implant placement and provisionalization. And I basically tell the audience, give them experience, more like 20 plus years of experience from where we started from until now, because a lot of concepts have changes. And so we understand how to treat the patients a little bit better, from implant size to how we manage the gap, how we position the implant, to how we provisionalize. All those factors, over time had changed the concepts. So I believe now in 2018 we understand a little bit better on how we manage implant aesthetics.
And it was, according to the chart that you showed, it's a matter of millimeters, no? The changes and what it was known from the table that you showed that made in the 1992, I believe, or something like that, to the one that you had now done with CV scanning,
right?
CVT.
Yeah, so basically, first of all, in dental aesthetics, overall, it is all about a millimeter here, a millimeter there.
Yeah.
Dentistry is all about little tiny things, right? But little, you lost 1 millimeter here, 1 millimeter there, then you have a big hole and you have aesthetic problems. So basically, in terms of tooth size-wise, we know nowadays we try to place implants, select implant diameter based on the buccolingual dimension of the socket. And due to the fact that, as I shown on the data, most of the maxillary anterior teeth, the width of the teeth are usually central incisors that is 6 millimeters or less. Therefore, nowadays, in general, it is better not to put implant that is 5 millimeter or bigger for a central incisor.
And you use a very nice, funny sample of a failure that you had way back, to illustrate and just to also, I guess, gave a comic, not so serious sample, of how things could go wrong. Although many people think that it was the perfect work, no?
Certainly. The reality is, people should not think just, you show a case 20 years ago, that's why there's a failure. Realistically is we can place implants or we can do cases now. Failures can occur too, all right? But back then, 20 years ago, of course, I show you some of the concepts that at that time is correct, but now it may not be so correct anymore. So we evolve, we change, we become better. And I was very fortunate that I'm able to solve that problem when the patient comes back 16 years later.
So you're still teaching also at Loma, yes?
I do teaching and I also do private practice too.
So for more information about practices and courses, just go check the page, the web page.
You can go to websites, you can go to Google, you can probably find out where I'm actually.
Thank you very much for your time, Dr. Kahn.